Back to KETK's East Texas Live. Well, joining us in the living room now is Mari-Carmen from CHRISTUS Trinity Mother Frances.
And today she's going to tell us about it being Stroke Awareness Month. Good morning.
Good morning. Thank you for having me.
No problem. So what is Stroke Awareness Month?
Well, it's just a month that we focus on making sure that the patients and our community really knows what strokes are and how we can prevent them, and what they need to do when they do have the symptoms of stroke.
So how common are strokes then?
They're very common, actually. Sorry, I can't remember the exact number, but
yeah. But you have a lot of patients
hundreds
that
and
come
hundreds
in.
of
This
patients.
is an issue.
We usually have about 75 to 100 a month.
Wow.
That come in for
Now,
stroke.
Yeah.
What causes a stroke?
Usually it's caused by a clot that forms somewhere in your body and moves up. It goes into the brain and occludes or blocks that area of the brain, causing that area to not get blood flow, and it essentially can die if it's not treated.
So who really is at risk for this then?
More people than you might think.
Yeah.
Young women that are on birth control and smoke, they're at high risk. Patients that have high blood pressure, high cholesterol, those that are diabetic, obesity can cause a stroke, smoking, of course, as well as irregular heartbeat called atrial fibrillation can cause a stroke.
Mm-hmm.
Now what can, the common everyday person do to try to prevent stroke?
To prevent it, you need to go to the doctor. Make sure that you know if you have high blood pressure or diabetes or high cholesterol. Those are really easily treated things, but you have to know that you have them and take the medication prescribed by your physician. Also, if you do have those, then exercise and diet would be a helpful thing, but not to replace the medication unless your doctor says it's appropriate.
Well, I was going to say, how does someone know that they're having a stroke? Like, what if they're at home? What are really the symptoms?
We teach our patients fast, face, arms, speech, and time.
Okay.
So if you notice that you have symptoms like you can't talk very well all of a sudden, or your face gets numb, or you have weakness in one arm or the other, test yourself. If you're the family member, test your family member, and then it's important to call 911. I have a lot of patients that it'll go away.
It'll pass, yeah.
And it doesn't. They wake up from their nap that they thought would help, and those symptoms are sometimes devastating.
Yeah.
So come to the hospital by ambulance. We use a stroke app at CHRISTUS Mother Frances. Sorry. That alerts us from the ambulance to tell us that the stroke patient is en route.
Oh, wow.
So that we can activate the team and have them all ready to stand by so that patient can get the treatment that they need.
Now how is a stroke treated?
Within about 4.5 hours from the time at the onset of stroke symptoms, we have capabilities of giving what's called Alteplase or Activase. It's a clot busting medication. It goes in through your IV, mm-hmm. and it can dissolve the clot that's causing the stroke. Sometimes strokes are bigger than that, that clot busting medicine can dissolve, and we have interventional radiologists at our facility that can go in by arteriogram, just a little puncture in the groin, and pull those clots out and potentially resolve the symptoms
Wow.
of the stroke. That's all if you get there in time. So it's just really, really, really important to come to the hospital when you have those symptoms.
Okay, thank you so much.
Thank
Good
you very
information.
much.
Thank you.